Hello viewer, today we'll be teaching you how to perform proper blood pressure technique. So if you want to learn, just keep watching.
So you want to make sure that you have the artery mark right in the carotid artery, and you start taking the pressure. You might pass out, it's perfectly okay.
Just kidding, this is how you really do it. So first, you want to instruct the client prior to the test to not drink any caffeine or tea or smoke 30 minutes before the actual test. About 3 to 5 minutes before you perform the test, you want to have the client sit in a relaxed position with their feet flat on the ground. Okay, first thing is you want to have the client remove any outerwear that they may have on, and then pull away any clothing that they may have on their arm. Next, you want to place the sphygmomanometer about 1 inch above the brachial artery, and you want to make sure that it's on a little tight so that it doesn't fall off, but not too tight that it cuts off their circulation. You can either place the gauge on the cuff, or you can have the client hold it for you. Next, you will place the stethoscope a little bit above the brachial artery and pump the cuff up to about 20 millimeters of mercury above the client's estimated blood pressure. If you do not know their estimated blood pressure, you can pump it up to about 180 to 200 millimeters of mercury. You want to release the air from the cuff slowly of about 2 millimeters of mercury per second. And you want to listen for the first Korsakoff sound, which will be the systolic pressure, and then for the fifth Korsakoff sound, which will be the diastolic pressure. Once you hear the fifth sound, you can release all of the air from the cuff and remove the cuff from the client's arm.
Very good. 117/80. Yes.
So like I said before, the first Korsakoff sound you heard was the systolic pressure, which is the higher pressure that occurs when the left ventricle is contracting. And the fifth Korsakoff sound you heard is the diastolic pressure, which is the lower pressure that occurs when the left ventricle is refilling. This client had a blood pressure of 117/80, which falls within the optimal category. This suggests that your client is healthy. If your client has a blood pressure within the high normal or above, you want to let them know to go see a primary care doctor so they can undergo any necessary treatment. Another way you can take the client's blood pressure is by using an automatic blood pressure machine. Just place the cuff an inch above the client's brachial artery. Again, a little tight so it doesn't slip off, but not too tight that it cuts off their circulation. And then simply press the start button. The machine will do all the work on its own. Just make sure you instruct the client not to move so you can get an accurate reading. So let's say you need to do a blood pressure check on a client who is performing a graded exercise test. You will do the exact same steps as before, but with just one extra step added. After you place the cuff on their arm, put the gauge in place, and put the stethoscope in place, you will have the client put their arm on your forearm and completely relax their arm so you can get the most accurate reading possible. And then once again, just pump up the cuff and listen for the first and fifth Korsakoff sounds as you release the air. Once you've gotten the reading, just remove the cuff from the client's arm so they can continue performing their test.
Can I get some water, please? Sure.
Thank you so much for watching our video, and we really hope it helped you learn how to take an accurate blood pressure reading.
No skeletons were harmed in the making of this video.